Welcome to Adapt NCLEX. If you're taking the NCLEX and you saw this case study, how are you going to manage it? It may be challenging to you, but don't panic. I got you. I will show you how to approach this kind of case studies that you have no clue and be able to master it. Let's get to it. So this is the case study. If you're taking the NCLEX and you see this, what do you think? A nursing emergency department is caring for a 24-year-old client who presents with what? Sudden right ear pain after diving into a swimming pool. This is where you have to apply test-taking strategy and what? Buzzword. The client report, I felt a pop in my ear, then muffled hearing in the right ear, ringing in the ear, and a clear fluid draining from the ear. Mild vertigo when turning the head. Temperature 98.4, heart rate 84, blood pressure 118/72, respiratory rate of 16, saturation 99%. No acute distress. There is no post-auricular swelling. That means behind the ear, there is no swelling. When you do the examination of the ear, you see small disruption in the right tympanic membrane with minimal clear drainage. What do you think? This is the way you answer questions regarding case study. You may have no clue, you don't expect it, and they throw this at you. Are you going to panic? You said, I have no clue. Thus, you can answer it without any problem. How? Go back to the case. Look at it. 24-year-old. What happened? Sudden right here, pain after what? Diving into a swimming pool. Have you had that experience before? You dive into a swimming pool. The client report, I felt a pop in the ear, one buzzword, followed by muffled hearing in the right ear, then ringing in the ear, and a clear drainage from the ear. Something is telling you something. Then I have vertigo, but it's very mild vertigo, except when I turn my head. Temperature 98.4, and the rest of the vitals normal. You examine the patient, there's no post-auricular swelling. That means behind the ear, there is no swelling, and there is disruption in the right tympanic membrane with minimal drainage. What do you think is going on? And how would you approach this question? That's the key. Based on what we've gone through, I've given you all the things you should use, put it together, and you'll be able to figure out what is going on with the patient. The question is asking, which of this is concerning? Select or apply. A sharp, sudden ear pain is bad. The temperature is normal. When you examine the patient, what you saw is not reassuring. Small disruption in the right tympanic membrane with minimal drainage. You need to figure out and find out what is going on. I'm going to pick this. Ringing in the ear is a warning sign. And the muffled hearing, that means your hearing is affected, is a problem. These are priority things you have to follow up because they are concerning. Next thing, what do you think is going on with the patient? I've given you diagnoses. Look at each of them. See if it meets the criteria in the question. If it is, you pick it. Acute otitis media, Meniere disease, tympanic membrane rupture, acoustic trauma. Let's start from the top. Acute otitis media is an infection. If I have infection, I'm going to have temperature. I have not given you lab work that tells you there's no infection. And the patient temperature is what? Afebrile. You cannot pick this. Otitis media does not happen right away when you jump into a swimming pool. It may take some time before you have the infection. And the drainage should be a little bit prevalent. This is a clear drainage. This is telling you should not pick otitis media just because you know it. Meniere disease, mostly vertigo. The patient has mild vertigo. Therefore, eliminate it. Acoustic trauma, there have to be some trauma due to sound. There is no trauma due to sound. Therefore, this patient has a tympanic membrane rupture. You see, you got it? Now, you can use that to answer the question. 30 minutes later, what is happening? The patient has worsening dizziness. Initially, the dizziness is small. Now it's worsening and they have nausea. Which action should you take? This is prioritization. If you have a patient who is having dizziness and vertigo and is worsening and nausea, what would you do? Do you give them antibiotic? Do you assist the client to lay down and ensure safety? Irrigate the ear canal or obtain culture? The question say, I feel dizzy, and my dizziness is worsening. Safety, safety, safety. This is a safety question. Oral antibiotic is not going to help them because the patients already have nausea. Irrigating the ear for tympanic membrane rupture, you should not put anything to the ear anymore. Culture, the fluid is clear, it's not infectious. Safety, assist the client, lay down, ensure safety. Next thing, the client was diagnosed with what? Tympanic membrane rupture. The provider provides discharge teaching to the patient. Sometimes you can send this patient home. You have to know how to deal with this patient. Avoid getting water in the ear. Is it a good teaching? Blow your nose forcefully to clear the pressure. Avoid air travel until the wound has healed. Use cotton swab to keep the ear clean. Report increasing pain or fever. What do you think? You have otitis, tympanic membrane rupture. It's going to get worsen. If you get worsen, you get infection. Report fever. You should not never put anything in the ear if you have tympanic membrane rupture. The membrane has rupture. What is the tympanic membrane? If this is your ear and this is the middle ear, there's a separation here. This is the outer layer and this is the deep inner layer. This is the tympanic membrane. When this rupture, you can see there's communication between the innermost part and the internal and external layer. Therefore, we don't want that to happen. Don't put anything in your ear anymore. So report fever. Don't put any cotton in your ear. You should not travel because the more there's different in pressure, it's not going to heal. You should not blow your nose because that will create pressure different. And you should avoid getting water in the ear so that the tympanic membrane can heal itself. Something happened again. 3 days later, the client, what happened? Returned with what? Now the patient has fever. There's drainage more and there's more pain. You see, it's different from the initial. That's complication when you have tympanic membrane rupture and you have fever, turbulent drainage, and increased pain. This is due to what? Is it otitis externa? That means the outer ear that you can see. Acute otitis media, the middle portion. Is it mastoiditis or Meniere disease? You have to know the definition of each condition, and this is what the NCLEX will give you. It can give you the same scenario and will change it. So I'm trying to get you there. It's not otitis media. It's not outside. The most common complication is otitis media. Mastoiditis, you're looking for tenderness at the periauricular area. There's no tenderness. I've not given you that. And Meniere disease, we're talking about vertigo. Now, 12 hours later, the client returned with what? More fever, increasing pain, now thick yellow discharge. There's tenderness behind the ear. That's the buzzword. And a slight protrusion of the auricle. Which one is now? Is it otitis externa? Is it acute otitis media or mastoiditis or Meniere disease? This is what? Mastoiditis. That's behind your ear. When it starts getting tender, that means the infection has spread into the bone. What do you need? You need CT scan immediately, antibiotic, and surgery for drainage. This is Adapt NCLEX. If you see this question, don't run away from it. Sit down, master it, know this information. Watch this video multiple times. Know the difference between otitis media, acute otitis media, otitis externa, mastoiditis, and Meniere disease, so that when they give you a case study like this regarding tympanic membrane rupture, you can know the difference. If this video helped you, put the like button and subscribe to Adapt NCLEX for more content like that. Thank you very much. Bye.